Ian, send me a message when you want me to start.
Okay.
Hi, everyone. We're just waiting for our viewers to trickle in, and we will get started momentarily. Thank you. All right, here we go. Hello, everyone. Welcome to the Canadian COVID-19 Vaccine Town Hall with Theresa Tam, Dr. Theresa Tam, and our esteemed panelists we're very thankful that you guys joined us here this evening. I want to introduce myself. I am Miranda Ferrier. I am the CEO of the Canadian Support Workers Association and the Ontario PSW Association. This town hall is being featured by the Canadian Support Workers Association, the Ontario PSW Association, and Unity Health Toronto, and we want to welcome you all. I want to give a shout out to some of the leadership team that is joining us here this evening. I have Ian De Silva, our Director of Operations, is on here. Debbie Jensen, who is our HR manager, and our PR firm Wellington DuPont, who is on the back end helping us out this evening with your questions and your chat. I also want to give a shout out really quick because we are being represented across our nation. We have a couple of our chapter presidents who have joined us here this evening from the Canadian Support Workers Association. We have Elise Floyd from Saskatchewan, our chapter in Saskatchewan, and Daphne Beck from our Newfoundland and Labrador chapters. So welcome and thank you very much for joining us. Now to get to the real reason why we are all here this evening, I would like to introduce our panelists. We have Dr. Theresa Tam, Chief Public Health Officer of Canada. Dr. Tam is an infectious disease specialist who served as Assistant Deputy Minister of Infectious Disease Prevention and Control at Public Health Agency of Canada. So very welcome, Dr. Tam. We have Dr. Vivian Iua. I think I may have gotten that. And she joins us from Alberta, a clinical associate professor and section chief seniors care at University of Calgary's Faculty of Medicine, medical director, facility living, Alberta Health Sciences, Calgary Zone. And Vivian is a staunch advocate for geriatric issues nationally. And last but certainly not least, we have back again Dr. Kevin Gough, who's been with us many times on our town hall, and he is the Director of Infectious Diseases, St. Mike's College Hospital in Toronto. So I just want to say welcome to all of our panelists. And again, thank you very much for joining us. I'm actually going to turn it over now to you, Dr. Tam. Would you like to start us off with some opening remarks?
Well, thank you so much, Miranda, and the other organizers and my fellow panelists and thank you for this invitation to participate in your town hall today. So I am from Ottawa on the traditional unceded territory of the Algonquin Anishinaabe people. So it's a great pleasure to connect with you from the various territories and communities that you are in today. So this week is actually World Immunization Week, as well as our National Immunization Awareness Week here in Canada. So a year ago, during the same week, National Immunization Awareness Week, I actually talked about how vaccines play a significant role in preventing and controlling the spread of serious, life-altering, and sometimes fatal diseases like measles, pertussis, sometimes called whooping cough, influenza, diphtheria, and polio in Canada and around the world. And I actually ended that reflection by saying, well, a vaccine may also one day be available to prevent and control the spread of COVID-19. So what a difference a year makes. So now not only do you have many examples of life-saving benefits of vaccines across many of the other infectious diseases, but we now have COVID-19 vaccines rolling out, and we're already beginning to see some of the differences they are making. And so we will be talking about some of that and answering your questions today. So I think that globally, COVID-19 has affected every area of the world, with over 3 million reported deaths. So I think it's pretty clear to me that these safe and highly effective vaccines have a big role to play in terms of saving lives, averting more deaths, and helping us to end the pandemic. So this year, the theme of World Immunization Week is vaccines bring us closer. So I think vaccines will bring us one step closer to doing some of the things that we love to do, to be in closer contact to the people that we care about, and to reconnect socially with friends and family. And secondly, vaccines bring us closer to a world where no one suffers or dies from a vaccine-preventable disease, such as polio. It was actually quite remarkable that August of last year, August 2020, August the 25th, in fact, in the middle of the pandemic, the Africa region was declared free from wild polio. And being someone who's worked in this area for a long time, that was such a remarkable moment. And it really sort of helped me reflect on the fact that vaccination is one of the most effective ways to protect populations around the world. And it has in the past 50 years saved more lives in Canada than any other health intervention. And so lastly, I do think vaccines bring us closer to a healthier and more prosperous world. And we are all connected around the world. So in this interconnected global community, none of us are protected until everyone is protected. And also, I think the pandemic has shown us how health, social, and economic conditions are so linked, and we cannot have a thriving community without good health. So I think it's remarkable, certainly, and sobering on the other hand, that we've been in this pandemic for over a year now, and personal support workers have been at the forefront of this crisis. Whether you're working in long-term care, home care, hospitals, other healthcare settings, your work has never been more challenging or important as it has been in the past year during this pandemic. And I really feel you've led by example, demonstrating your strength, courage, and resilience. And I have the utmost respect for the work that you're doing. And at the front line, as frontline support workers, you were certainly amongst the first to witness and feel the devastating impacts of COVID-19. You've had to adapt to many new ways of working, often with a lot of uncertainty, which is one of the challenges of, I think, living through this pandemic together. I've heard how many workers on the front line has really felt the strain on their personal lives, their physical and mental health. And so I just want to acknowledge your efforts and the invaluable part that you have been playing in this response. Yes, we do have a ways to go. Right now, we're in the middle of our third wave. However, I'm very hopeful because in recent months, we've seen some major declines in serious outcomes and deaths amongst those living and working in congregate care settings, thanks to the high vaccine uptake amongst staff and residents. In Alberta, just as an example, the number of active cases of COVID-19 in long-term care facility has dropped about, from a peak of about 776 cases late December to now less than 40 a day, just 4 months later. And hospitalizations are down by 93% and deaths by 94%, which is pretty remarkable. And we've seen many similar trends around the country and showing us the effectiveness of the vaccines that we have and what can be achieved if the uptake is high. It's very understandable, it's normal to have questions and concerns about any vaccines or any treatments or any medical procedures. So I think from a Public Health Agency of Canada's perspective, the organization I work with, I think our job is to provide information so that everyone can make the best choice for your own health and for the health of your families and other people that you care about. So, which is why I think having town halls like this to answer questions is very, very important. So, we've been studying the perspectives of individuals across the country for some time as it pertains to immunizations. And we know that many people in Canada really want to get the vaccine. But some individuals have intention to get the vaccine, but still want to ask a bunch of questions, which is normal, as I said. But I think when people have questions or they're hesitant, it's not, to me anyways, just a simple reflection of confidence in the vaccine or our systems. A lot of, I think, barriers are a matter of access. Access to vaccinations is really important. And I realize that many of the barriers might be related to the inability to get paid time off work sometimes, challenges in physically getting to a clinic at hours that might not be suitable. And sometimes it's really difficult to navigate all those online systems, registrations, and that type of thing. So all of those things can reduce the ability of individuals from getting the vaccine. I'm also appreciative of the fact that in past pandemics, sometimes you don't have enough information. But during this pandemic, in the internet, social media age, we have a lot of information overload. And the World Health Organization has coined the term infodemic to describe how our current environment of ever-changing information is really a challenge for everyone, including misinformation, the wrong kind of information, or disinformation. Some people actually deliberately put out the wrong information as well. And so, and because of this, addressing these misinformation or disinformation is actually one of the most challenging aspects of this response. So in the spirit of World Immunization Week and this theme of vaccines bring us closer, I'm really happy that we have the opportunity to gather virtually together and to discuss vaccines. And I hope that is going to be helpful for you. And I'm really looking forward to your questions. And again, I want to say thank you, merci, and miigwech. Thank you.
Thank you very, very much, Dr. Tam. Theresa, thank you for your very kind words about personal support workers who have been in the trenches on the front line across our nation, and they truly are, and I don't want to use the term heroes because I think that's overplayed, but in my mind, they're superstars. So thank you very much for that, Dr. Tam. I'm actually going to start off asking Dr. Gough, Mr. Kevin, a question. We received lots of questions from a lot of the viewers prior to this town hall, and thank you very much for all of your questions. Unfortunately, I cannot promise that we're going to get to them all today. I know our esteemed panelists will try their best, and so will I. But we only have about 45 minutes to get through as many questions as possible. So please know that we are trying. So the first question, Kevin, comes from a personal support worker. So it says, I'm a recent PSW graduate and was not able to receive the initial vaccine because I was not employed at the time that the vaccine was made available to healthcare workers. In other words, because I was not yet employed, I was not placed on any employer's list for the vaccine. Now that I am employed in the Grey County and work with vulnerable people in the community, I am no longer a priority to get the vaccine. I was told that I must regularly check with general registration like the general public. I am confused why, for example, someone who is 40 years old and does not work in the healthcare system has the same priority over myself. I am struggling to get on the list. This does not make any sense to me. Please help me understand. Kevin.
Great. So thanks very much for the question. And this question was forwarded to me in advance. So I thought I would take the opportunity to navigate the system for myself to see how this works. So I actually went on and tried to book a vaccine, assuming that I lived in that particular area, and tried out the websites, etc. A little bit of opportunity to improve the websites, but there's a telephone number there, and I did put a call out to them, extremely helpful. 3 people got back to me within 1 to 2 hours. That was my experience. But in answer to your question, and I did pose that question to them, as a healthcare worker in that particular area, you would be part of a priority group for them, as well as others who are prioritized in that area at the same time. So people with high-risk health conditions and their essential caregivers, staff at high risk, congregate settings, etc. You would be in that same category as others who are prioritized as a PSW, as a healthcare worker. So you wouldn't be competing with the general public per se. Just a heads up, they do have 3 different streams of vaccine. One is through the government, one is through the local, and another is through the pharmacies. So it's a different system in each area, so we won't delve into this one in detail, but I would suggest that you contact them and apply through the local, was the advice they gave, apply through the local access, and you would be prioritized as a healthcare worker. But just in terms of vaccine in access in general, I wanted to give a shout out to Vaccine Hunters Canada. And I don't know if you're familiar with them or not, but they're a volunteer group that helps Canadians navigate the often convoluted vaccination rollout that's happening for a whole bunch of reasons that are understandable, but it can be pretty complex. And they connect people with available doses of vaccine, which is a fantastic initiative. They use social media alerts and a website to document where people can go to get a vaccine across the country. They provide real-time updates, including number of spots left at a particular clinic, for example, or whether it's full. I went on today and looked at the clinics in my area, and one was open, and then they said, oh, we filled up, we've got enough people for vaccine, don't bother getting in the car and coming here if you want to. So it's that kind of helpful information to access the vaccines. And I know that the City of Toronto has recently partnered with Vaccine Hunter Canada to help eligible people in the Toronto area find vaccines. So shout out to them. They're at vaccinehunters.ca and their Twitter handle is VaxHuntersCan. So hopefully you'll be able to get vaccine in your area.
Thank you very much for that, Kevin. And he did do his research on it, so I thought that was really cool. Thank you very much. The next question actually goes to Dr. Tam, Theresa. The question is, why are PSWs and other frontline workers not vaccinated using a national rollout model? It would appear distribution is not equitable or consistent province to province, city to city, neighborhood to neighborhood. PSWs are exposed to patients, family members, and other workers for extended periods of time every day.
Yes, so in Canada, at the federal level, which is the level that I work with, many of my colleagues, their key role is getting the vaccine into the country. And the vaccine is then allocated on a per capita basis to the provinces and territories who are in charge of rolling out the vaccine programs. So one of the other roles that we have is provide recommendations through the National Advisory Committee on Immunization. And through their guidance, it is very clearly sort of stated that those at the highest risk of illness, such as seniors and those living in congregate settings like long-term care homes, but also healthcare workers who are in doing direct patient care. So that is laid down in guidance, and then the provinces do then take on their own role. We at the federal level do not have actual vaccine programs, and the provinces do. So, you know, I can't speak to individual specific situations, but I do know from other chief medical officers of health, for sure, healthcare providers, personal support workers who are directly working with patients are at the top of those priority lists. But I don't know that I can address a specific individual question.
Yeah, questions are fun like that with town halls sometimes, right? You try to put them in the right order and all sorts of good fun. So I'm sorry, Theresa, to put you on the spot yet again. I have one more question for you, and then we're actually going to move on to Vivian. But the question I have is, at what point will the national vaccine rate allow people to gather outdoors or indoors together? When would it be advisable for people who are fully vaccinated to gather without restrictions?
Well, maybe just a bridge from the last question is that there's more and more vaccine doses available. This week itself and the next coming weeks, we're going to get like over 2 million doses a week, which is the highest vaccine amount that we've had coming into the country so far. So more and more people are going to be able to get vaccinated. And that, you know, by the middle to the end of June, there should be enough vaccines to provide to any eligible population in terms of the first dose, but also that some individuals would be vaccinated with a second dose as well. So the question that is posed is actually a very important one, but not absolutely certain. You know, I don't have a date and I don't have a specific number. But I actually just gave a presentation on Friday, which says, you know, the absolutely critical thing right now in the 6 biggest provinces is to get that third wave down. And that can only be done through these public health measures that your local and provincial authority putting together, so that you reduce the mixing rate. Reducing the contact rate amongst people is the fastest way to get that curve down, plank that curve, while you give room for the vaccine program to escalate. So that is really, really important. What allows all of us to do more is actually when the rates of infection is low. Never mind the vaccines, you've had this experience before, right? When the cases are low, more things can open up and more people can gather. And so it's driven very much by where that curve actually is. But vaccines play a really important role. So if we let time to get everybody vaccinated, what I said was you can plug in lots of scenarios, but under certain conditions, and there's variance and all sorts of different factors. But if you look at about 75% of people having had their first dose, together with at least 20% having had their second dose, and you try and lift those restrictive measures, then there's a good chance that you won't get back into that big resurgence and your hospitals overflowing or your ICUs overflowing. So that is a concept we've actually just came out with, but it's not a hard and fast number or a hard and fast date. But what I've been saying to people, I'm really hopeful over the summer. So get this curve down. That summer period, I'm really hopeful that with one dose and then more and more people getting that second dose, people will be able to do definitely outside. I mean, outside is a less risky place than any indoor gathering. But I'm also looking even further than that into the fall. If we have, as many people as possible vaccinated towards fall, I hope that a lot of workplaces, schools, universities, people haven't been to university in physically. And so those kind of places, while you may still have to wear a mask and maintain personal measures, but at least you can open a lot of these spaces without outbreaks resurging again. So those are some of the really key goals that we have. And I hope that gives you at least an idea, but the key approach is to do it slowly. Slowly release, watch if it leads to a resurgence, release some more and watch. And that's perhaps where I will stop. And hopefully that was helpful.
That was very, very helpful. I'm actually going to jump a bit off script right now because it went nuts in the chat when you were talking away about the vaccine and the dosing. Now we have a couple questions here, and it was saying, is it dangerous to wait so long between doses? A lot of personal support workers and members of the public have already received their first dose, where it be the Pfizer or the Moderna or whatever. And now they have to wait a considerable amount of time, 4 months, 5 months for the second shot. And their concern is that it's not going to work, or, so the question is, is it dangerous to wait so long?
Yeah, so it's a really important question. So Canada, actually quite similar to the United Kingdom, has taken a strategy that we call first dose fast to as many people as possible, which actually is a really good strategy for a number of reasons. One is that we actually have seen a really good response from that first dose, and that people are protected at pretty high level after that first dose, particularly in reducing deaths and serious outcomes. Over 80% of effectiveness, at least, from all of the vaccines that we have in Canada, are very good at reducing serious outcomes. And they're actually now, there's more and more data to say that, in fact, they can reduce milder illness, maybe asymptomatic infection as well. And just now, there was a sort of preliminary article from the United Kingdom to say that that first dose actually does reduce transmission. But hold on, not so fast. You actually need that second dose just to boost your level of immunity and make it last longer. So that's what that second dose is. What is difficult for everyone to understand is that most vaccines are given with quite a big interval, and your immune system actually sometimes works better if that interval is longer. And so in the clinical trials, they didn't have time to do the stretch interval for the most part. They wanted to get the trials done. So they said, okay, 3 weeks, 4 weeks, let's see what happens. Well, they worked really well after 3 and 4 weeks. But we know that they're very likely to work if just as good if the interval was stretched. So many experts came together, the National Advisory Committee on Immunization, together with all the chief medical officers of health across the country. And we made this collective decision that this was a good strategy for Canada. Because what happens is if you had half the people with 2 doses and the other half still vulnerable, particularly if you took an age-based approach, younger people would take way longer to get their first dose. That is actually a setup that results in more transmission and more spread. So this idea of getting the first dose into as many people as possible, coming back to reinforce that with the second dose is really important. And I'll just show you one example. The AstraZeneca vaccine actually in the clinical trials shown that it worked better at 12 weeks than it did at 4 weeks. And that is actually how many vaccines work. So it's with that kind of expert advice that we came forwards with this stretch interval. The United Kingdom has done really well with the planking of their wave all the way down to the bottom with many people mainly having had that one dose, and public health measures. It is safe. It would not result in any adverse events. The key, though, is to keep up with your personal protection in between those and beyond even the first and second dose. Keep up with those measures, because we want to learn more about what happens with these vaccines and what happens to the virus in the community. But yeah, it's a really interesting point, and one that I think many people had questions about. Canada is going to be at the forefront globally in that we have data from British Columbia and Quebec over 12 weeks now into that first dose, showing that we have good effectiveness even to that point in time.
And just if I could add to that, if I might, we know that with other multi-dose vaccines that we use, like hepatitis B, for example, as was mentioned, most of the antibody response comes from the first dose, and then the subsequent doses boost that a little bit higher and extend that duration. So it's not surprising that would happen with this. It makes biologic sense. It makes sense that we could do that. We also know with the hepatitis B vaccine, for example, that you can delay giving these subsequent doses. So again, extend the interval between those doses, and it doesn't have a bad effect at all in terms of the final level of antibody protection that you get, nor your immune system's ability to remember how to fight off hepatitis B. So it happens with other multi-dose vaccines as well. So it makes sense from a biology perspective that it would work with this vaccine.
Thank you very much for that. Vivian, do you have anything to add to that?
No.
No, everyone just cleared it all. Okay, wonderful. Actually, my next question is for Vivian, because you've been sitting there looking wonderful and patiently as we're trying to get through all of this here. So the question would be, what is the risk of blood clots with the AZ vaccine and the Janssen vaccine? Or I guess that would be Johnson & Johnson, maybe?
Yeah. The Johnson vaccine is the Johnson & Johnson vaccine. So blood clots associated with the AstraZeneca vaccine and the Janssen vaccine, it's a very unfortunate and extremely rare complication that can occur from taking those vaccines. What happens here is what we refer to as the vaccine-induced thrombotic thrombocytopenia, where unfortunately the body produces antibodies to a specific platelet activating factor, and that results in a cascade of thrombosis and a reduction in the number of platelets, and so you have an increased risk of bleeding. So very unfortunate, but extremely rare. And so what do we know in terms of the rate? So we know that the rate is about 1 in 250,000. And in real world data, so what we've seen amongst people who have had the vaccine. So in Canada, we've had, as of April 24, we had about 5 cases of the vaccine-induced thrombotic thrombocytopenia in 1.1 million people that had been vaccinated with AstraZeneca. And in the United States, as of April 9, we had 8 cases in 7.2 million people that had received the Johnson & Johnson vaccine. So extremely rare. So in the situation that we have now, where there's a high risk of exposure to COVID-19, if you balance that with the risk of this vaccine-induced thrombotic thrombocytopenia, then the benefits of taking these vaccines far outweighs the risk. And so if you do get COVID-19, especially with all the variants and the higher transmissibility, infectivity, and you have severe COVID, your risk of getting blood clots is actually 1 in 4. And so when you balance those risks, you're better off taking the AstraZeneca or the Johnson & Johnson vaccine when it becomes available.
Thank you very much for that. And I'm going to admit right away that I was one of those people who was a little bit worried and had to reach out to Dr. Gough and ask him some questions. And he told me, because I'm in the over 40 crowd, so it calmed me right down, explained it to me so perfectly. So now I have an appointment. So it's all good. So the next, yay. So the next question that I have actually again is for Dr. Tam, Theresa. It says, will there be a possibility that Canada will produce their own vaccines? The UK did it within a year when the pandemic started with a license from AstraZeneca.
Yes, so I think this particular individual who posed the question recognized that Canada actually had to put in place 7 different contracts with 7 different vaccine manufacturers, just so that we can be prepared to get that vaccine when it's available, because we didn't know at the beginning which vaccines were going to come through successfully through the clinical trials or when they were available. So many different contracts were put in place, and we were very fortunate in being able to get probably, all first 3 vaccines that got essentially ready globally, we had contracts for. So, and I think many people, so in the media, people keep tracking you and compare you to another country. Well, we are catching up really fast because the rate of vaccination and vaccines coming in are increasing pretty rapidly now. That is a really good question. We do have several sites in Canada that are getting ready to make COVID-19 vaccines, and there's been investments. One company that's undergoing clinical trials right now is called Medicago, and Medicago is located in Quebec and has a very novel and platform of producing vaccines in plants, actually. There is also government investment in a facility in Saskatchewan, as well as in Mount Royal in Quebec, also targeted to produce a COVID-19 vaccine. But we had to put in these contracts in the meantime, because we knew that Canadian generated vaccines will not be as fast as the internationally produced ones, but they will come into play later on in this pandemic.
Thank you very much for that. I think we're getting a whole lot of answers to so many questions, and I know at the association we get all the time, but we definitely don't answer them because we don't have the answers. So thank you very much. This next question actually is kind of like a 2-part. I know I'm going all over the map here, guys, and I apologize, but we have so many questions that are coming in and people want information. I have this one question. It's actually directed to both Kevin and Vivian. It's a very interesting question. If you can answer for both of your provinces, that'd be wonderful. The question comes from Phyllis De Silva of Brockville, and she says, I would like to know what guidelines are in place for nursing homes due to COVID with regards to children visiting parents in the nursing homes. I think there has been a lot of confusion in the public surrounding that. So if I guess maybe Vivian, you want to go first for Alberta?
Yeah, so in Alberta, we actually have a visitation policy. And so what we did, initially at the start of the pandemic, so that was way back in March, just like every other province, we went with the absolutely no visitors. We just literally shut down our nursing homes. And of course, we learned that there were unanticipated outcomes with that, and our residents certainly did not do as well. And we also recognize that caregivers are actually care partners, and they do have a role, and they are part of the care team. And so we changed our strategy to recognize the designated support person. And so this designated support person can be a family member, can be as somebody that, is a volunteer caregiver that the family or the patient have identified as key to participating in their ongoing care and key to the well-being of the resident. And so what we have now in Alberta is that each resident is able to identify 2 designated support persons. And these persons can come in every day if they want, in terms of just participating in the care. They do have to make an appointment and give some advance notice. And then they can also have visitors, but then the rules around the visitors are a lot more strict, especially if the site has determined from a risk assessment that, given the population, the building, the layout of the building, that there are challenges in having visitors come on site, then the site might choose to limit visitors just because of the risk to the site. Recently, and just only in the last 2 days, Alberta again has revised this policy, and starting on the 10th of May, each resident now will be able to identify 4 designated support persons. So we've increased the numbers. And I think that decision was made rightly so, because when you look at the high rates of vaccinations among the residents and the staff, the thinking is that we can start to open up a little bit more so that we can have more people at least participate in the care of their loved ones. We've also increased the number of visitors that can participate in outdoor visitation from 5 to 10. Now, even with the increase in the number of designated support persons that can be assigned to each resident, the site, so the organization that owns the care home, still has some flexibility in determining if they can actually accommodate an increase in the number of people coming into the site. Because we all know that the layout, the population, all of that definitely contributes, or at least can impact the spread and transmission of COVID in our facilities.
Go for it, Kevin. What about Ontario?
Well, I don't know is the short answer. It's not a sector that I work in, but I do know that, as was mentioned earlier, that the vaccination of residents and staff in long-term care facilities has made a huge dent and impact on the amount of COVID in the facilities. So I would be guessing about the details. Certainly I don't have the details that Vivian has about Alberta and Ontario, but I know that there are changes around who can visit and when, and they've relaxed since wave 1, but I don't have the details. But the vaccine strategy has had a tremendous impact in the long-term care facilities here.
You know, that they're actually boasting and saying that the long-term care homes in Ontario are the safest places to be right now if you are ill or whatever, just because of the high rates of vaccinations. We don't have a ton of long-term care homes and COVID outbreaks, I'm proud to say. So our PSWs are kicking it out. So it's, you know, we're happy about that, but thanks, Kevin.
Yeah, perfect.
Thank you. So Dr. Tam, I have a doozy here for you. I got a few. So, because I'm doing questions, this, that, everything. There's a question here. It says, will we need a COVID-19 vaccine every year, like the annual flu shot? And how long is the efficiency of the vaccine after taking both the doses?
I may just switch some of those pieces around a little bit. As I said, the first dose of vaccine is really already very good, and particularly for prevention against serious outcomes of 80%. But you know, the second dose is going to reinforce that even more. And so with the mRNA vaccines, for example, we expect over 90% vaccine effectiveness after that second dose, about 14 days after that second dose. And so I think, you know, that's really important to remember. In terms of whether a booster is needed or not, I think that we are, well, the manufacturers have been monitoring the situation as well, not just public health, and they are prepared to potentially adjust the vaccines, some of them testing different strains of the virus, because we've observed, I think people have heard of variants, people have, we're detecting some of these changes in the virus and carefully looking at whether the current vaccines provide maximal protections for the variants that are now circulating. So that work is ongoing, but I think the key is that the manufacturing and development pipeline is already getting in gear for the potential that we might need another booster. But I think the most important thing is to just keep monitoring the epidemiology and the rate of vaccination. What I would say is that many parts of the world don't have access to vaccines, and this virus is not going to go away, and for most of the world. And so until everybody has access to vaccines, the virus will continue to circulate. And where there are big outbreaks is where that virus will continue to mutate and undergo changes. So I think the question that was posed pertains to one of the potential scenarios that could happen is that while we may come out of the pandemic without these major impacts, the virus might continue to live with us over the next years. That's a possibility. And I think we just have to keep track of things just to see what next year's like as to whether we need further vaccines or not. So I think that's roughly where we're at right now. And I'll just maybe tackle the question of variants and vaccine effectiveness for a second, because those questions are linked in some ways. When viruses emerge, and at the beginning, when most people haven't encountered the virus doesn't change very much. But it will keep adapting to be maybe more efficiently transmitted amongst the human population. So I think we've seen some of that development just in the last months. And for example, there's a variant called B.1.1.7 originally reported from the United Kingdom. That's now in, I think, 120 odd countries around the world. It is our most predominant variant. It's represents over 95% of the variants in Canada. It will become our most common virus, COVID-19 strain, I think. That strain is, the vaccines all look like they're effective. There may be a little bit of reduction in effectiveness, but the vaccines look good. But we're also monitoring other variants, two others in particular. One variant, B.1.351, originally reported from South Africa, and the P.1 variant originally reported from Brazil. Those ones we're monitoring. There's not a huge amount of data pertaining to the vaccine effectiveness, but I think what I would say is that the vaccine is going to protect against these viruses to a certain extent. It's not going to be an all or nothing phenomenon. So the recommendation is still to roll out your sleeves. It will provide you with some protection. It's just how much is not entirely known, but I think those answers will come. But the different vaccines do have slightly different effectiveness against some of the variants, but certainly for the one that we're encountering the most right now and around the world, that one is well covered by the vaccine.
Perfect. And thank you for reading ahead for me, Dr. Tam, on that question, because that was my next question. So thank you very much for that, because I know there has been so much concern surrounding these variants, and just a lot of misinformation. So thank you very much for setting.
Can I maybe just add that the same method is effective in controlling variants. The United Kingdom that demonstrated that as well. They're the ones that had a massive outbreak with the B.1.1.7. The public health measures will help reduce that. And then they got the vaccines up and running. So keep going with those personal protections and listen to your local public health in terms of their measures that they're putting in place.
Okay, thank you. No, thank you for that. Thank you very much. I got a question here that could actually be open to all three of you, really truthfully, and it comes from the Q&A, and it says, would you happen to know or when mobile vaccine clinics will be available for elderly people living in their own homes who are housebound? It's a lighter question, community question, but still important.
So I can speak to the Alberta experience, especially in Calgary, is that what we have happening is that our home care team actually does the vaccination for the homebound clients. So that has been extremely helpful, because one of the things that we were seeing is that when these people were ready to move into long-term care, if they hadn't had their vaccination, then that was a significant risk, coming into that setting. So we've been able to have our home care team assist with vaccinating the homebound patients or residents.
You just gave me a new argument for Ontario, but okay, go ahead, Kevin.
So yeah, I know that those asks have been made. And there's talk of organizing some mobile vaccination clinics. But I think right now, what I'm aware of, and Sharon brought this to my attention before the meeting, is that certain people are reaching out to do this in various venues. So for example, in our facility, someone's taken it on themselves and a group of other people to organize working to give vaccines to frail older people in their homes. So it's not a formal structured thing through the government, but people are taking this on in different groups. So the advice would be to contact the local public health unit to see what's available in the area. They may have some idea, but I don't think anything has been formalized yet, but the ask is out there and recommendations have been made for that.
Thank you, Kevin. Anything from you, Theresa, on that? Is there chatter federally for that?
That is very much frontline local delivery, but what I do know is that we've been trying to provide some funding for local community groups and organizations to provide support for individuals in different communities so that they receive information, but also help access clinics as well. And I'm kind of excited about that because at the federal level, we don't get engaged in actual vaccine delivery. But I do know that the health system itself and even the public health system is not always the best approach. People trust others in the community, NGOs, non-governmental organizations, church groups, and others, indigenous organizations, organizations that look after immigrants and refugees. Some of them have a much better way of reaching different populations and also tell public health what's the best way to provide vaccines to different populations. So, so from the federal level, we've been trying to provide some funding for that to happen.
Excellent. That's always good news. Definitely always good news. So I do know that we have a few questions that have popped up. As we all know, a lot of us have kids. I know I have 2 teenagers. So we have a lot of people asking, when will children, so I'm thinking teenagers, be vaccinated? So 13 years of age and up.
So maybe I will answer that question. So right now, the Pfizer vaccines for 16 and up, the Moderna and Janssen is sort of 18 and up, and the AstraZeneca vaccine is authorized for 18 and up, but the National Advisory Committee on Immunization has recommended, based on the balance of risks and benefits, for 30 years and up because of the balance of risk for this rare thromboembolic event. So there's different ages. So what happens to younger than that? Well, in effect, 16-year-olds could get vaccinated when it's their turn, because when enough vaccines available. Some provinces have already started to provide vaccine to younger individuals, youth who have underlying complex medical conditions as well. The key manufacturer that has some sort of done the trial for the 12 to 15-year-olds is Pfizer. Moderna is also doing trials. So we do expect actually the Pfizer vaccine, which just based on reports coming out of the clinical trials have worked extremely well in the 12 to 15-year-olds, that the Health Canada, the regulator, will be looking at that data. And I can't tell when they'll finish the reviews, but I don't think we're going to have to wait too long. So just imagine perhaps our youth can get the vaccine before the next school year, for example. It's not an unreasonable sort of expectation. But there are also vaccines. So Moderna is also, I think, doing these clinical trials, and I think they finish enrolling in one of the major clinical trials, and we will have to usually wait another couple of months for information to be completed from those trials. The younger kids are also now enrolled in some of the clinical trials, but the results for those trials won't come until much later. Little kids, I think, as everybody probably know by now, actually generally have much milder illnesses. So one of the key approaches, if the kids are not vaccinated, of course, the parents, the family, the teachers, teachers getting vaccinated, that will help kids be able to get back into school without outbreaks occurring, and that they can sustain a healthy education and development.
Perfect. Thank you very much, Dr. Tam. I know my 12-year-old daughter is itching to get back to school and asks me almost every day when she can get vaccinated. So I know I can give her a little bit of hope. So as we're rolling into 9 o'clock right now, I just want to give an opportunity for each one of you to give some closing remarks, closing thoughts for our audience. Maybe we'll start with Dr. Gough.
Sure. So I'll start. Again, thanks for the opportunity to be here. And I echo the comments made by Dr. Tam at the beginning, just recognizing the contribution of PSWs, like really there at the beginning, front line, took it all for us. And I would go superstar/heroes, Miranda. I think that's fantastic. So pleased to be here to be able to provide any information. If questions come up later, please forward them to Ian or Miranda. I think we've talked about the vaccine safety, and I just want to say, when I started with this, when the vaccine first became available to me, I had lots of doubt and lots of questions, and I did lots of homework and things like this, looking out for opportunities to gain some information. So by doing that, I felt confident in the information that I received, and I got my vaccines and it all went well. But I do understand the apprehension. Good on you for coming out to events like this to learn more about it. And I hope you get all your questions answered, to roll up your sleeves and get vaccinated. Thank you very much.
I guess we'll do Vivian, if you'd like to.
Yeah, so thanks, Miranda. So yeah, I just wanted to echo what Dr. Gough and Dr. Tam have said already, which is the amazing work that the personal support workers have done. I lived through the first wave and the impact in long-term care. I lived through the second wave. It was, was brutal. And now the third wave, but there's a big difference. It's really a significant difference. At the peak of the second wave, I mean, just like Dr. Tam was saying, almost 800 cases in Alberta. But when I think about even my zone, Calgary zone, we were seeing close to, oh my goodness, close to 5-10 cases a day, 40, 60 a week. And the severity, the acuity was high, staff were sick. During the second wave, we actually lost staff, and that was very difficult. We lost frontline staff. And with the third wave, it's been a game changer. Since the 5th of March in the Calgary zone, we've had 9 cases, and we've had the variant. And what a big difference. I mean, we had 2 of our residents who had very mild symptoms. We've had nobody go to hospital. We've had some staff with the variant, very mild symptoms, very big difference between the vaccinated and the unvaccinated. And so again, the best shot is the one you get in your arm. And I can't say it enough. I mean, having lived through those 3 waves and right now seeing what I see in long-term care, I would say get the shot when you can. Thank you.
Thank you. And Dr. Tam.
Yes, just to say again, thank you so much, everyone, for your work. And I think, I hope we've answered some of your questions. I know that there are probably many that we haven't had time to address, but please keep asking them. We would, through different channels, certainly your health provider, some of our websites if you have access, such as the one from your local health unit or the Government of Canada, the Public Health Agency website. Remember to always question the information that you read. But I think the final word, just to echo my two panelists, is that the vaccines are working in a remarkable way. They have been very effective. And so I never dreamt, as I said 1 year ago, that we'll be in a position where safe and effective vaccines are available to everyone. I also think that one of the most important ways you can contribute is that you can be vaccine champions. After you've asked all your questions, I've learned a lot about vaccines. And if you've got vaccinated, please spread the word. I was inspired, I have to say, when I saw seniors getting vaccinated. I was thinking, okay, seniors are getting vaccinated. They're doing really well. They've actually got more medical conditions and they're doing great with the vaccine. Why wouldn't a healthy younger person do extremely well with the vaccine? So that's another way of looking at it. When I got my first dose of vaccine, I took a photo and I tweeted it out. And there is a sort of communication approach, a campaign called where you can, if you spread the word, or if you have a photo that you can take, and then spread it around in your Facebook or other social media channels, that really helps, because people look to their peers often, in their communities, and they feel a lot better when they see people that they know who got the vaccine and are doing well. And so I maybe would ask that you become vaccine champions. Thank you.
That's perfect, Dr. Tam. Theresa, thank you. We actually have PSWs that already are vaccine champions. We've done a video, they sent in their pictures, they share them all over our social media all the time. And that's when we saw the hesitancy go down. So it's true. Once we know that we're all going to be okay, we all go for it. So I just want to say a huge and thank you so much to all of our panelists, Vivian, Kevin, Dr. Theresa Tam. It has been truly an honor yet again. Kevin, nice to meet you, Vivian, and an honor to meet you, Dr. Tam. Thank you so much to Unity Health Toronto, Dr. Strauss, who has been nothing short of phenomenal and always helping us prepare these town halls for our members and for the public at large. Once again, if you guys have questions, a lot of you guys know how to reach out to us. Thank you so much, everyone. Remember to roll up the sleeve and get the vaccine. Have a great evening, everyone. Take care. Thank you.
Thanks. Bye.
Bye.